everybody, my name is Carol Mack. This tutorial will discuss the minimum necessary rule. It comes into play when you use TPO or make permissive disclosures. Minimum necessary standards are covered by two sections of the privacy rule. Section 164.502 introduces the rule. Section 164.514 explains what an entity must do in order to comply. Generally, a provider must use reasonable efforts to limit PHI disclosures to intended purposes. There are 6 exceptions to the rule when the minimum necessary rule doesn't apply. The rule doesn't apply when PHI is disclosed for treatment purposes. It doesn't apply when the patient is receiving their own records. It doesn't apply to records covered by assigned authorization. It doesn't apply when HHS is requesting the records. It doesn't apply to workers' compensation or OSHA cases. It doesn't apply to OCR audits. There are 4 implementation specifications in Section 164.514. On the topic of uses, an entity must identify persons or classes of persons who need access to carry out their duties. The provider must identify categories of PHI, such as billing, clinic notes, radiology, etc. For each category, the provider must consider whether conditions are appropriate to such access. After all things are considered, the provider must make reasonable efforts to limit unnecessary access. The provider must use standard protocols for routine disclosures. Non-routine disclosures must be reviewed according to criteria. A provider may rely on the requesting party's judgment if such reliance is reasonable. A provider may automatically respond to requests from public officials, covered entities, business associates, and researchers. These requests are presumptively reliable. The covered entity is responsible for limiting the scope of their request to achieve the purpose of the disclosure. Disclosing an entire medical record without assessing the purpose of disclosure is per se a violation of the minimum necessary rule. High-tech modifications were published in January 2013. The proposed rule promised future guidelines for business associates. Now we'll examine the minimum necessary rule in the town of Single Peak. Computer Guy and his girlfriend Gail work in the Old Town Plaza district. Gail writes for the local newspaper and Computer Guy owns a store. Gail is leaving work early because she has a doctor's appointment across the plaza. She's going to see Dr. Priscilla Pruitt. Gail is very worried about her condition. She didn't sleep well last night.
Good morning, Gail. Are you and Guy going to get married one of these days?
Did you really just ask me that question? I want to talk to Dr. Pruitt privately.
Gail put on a gown and waited for the doctor, and while she was getting her vital signs taken, Gail's mind flashed back to her childhood. Dr. Priscilla was the first doctor who diagnosed her with congenital heart disease. Today, Gail is 25 years old and she's worried about pregnancy.
Hi, Gail. What brings you here today?
Guy, he's been talking about us getting married. I never did tell him about my congenital heart defect. This morning, I did a urine test and discovered I was pregnant.
Pregnancy does put a lot of strain on your heart.
Is it safe for me to be pregnant?
I'm going to refer you to a specialist in the big city.
Does my insurance cover genetic testing?
I'll look into it. Don't worry, we'll come up with a plan.
Oh, good. I want to know more about the risk of pregnancy before I say anything to Guy.
Priscilla gave Belle a list of places to call to obtain more information about Gail's options. A short time later, Computer Guy came by.
Is Gail still here?
No, I'm afraid not. She went back to work already.
Did she tell you the news?
What news? You mean her pregnancy?
Whoa, I did not know. You really mean she's pregnant?
Hudson overheard the conversation and rushed into Priscilla's office.
Priscilla, we've got a problem.
What happened?
Belle disclosed Gail's pregnancy to Guy.
Sounds like she violated the minimum necessary rule.
What was Gail supposed to be doing?
Case management. She had to use and disclose information to coordinate high-risk pregnancy care. She needed to access insurance information and clinical information.
Deciding what to disclose requires professional judgment.
What did Belle say to Guy? What was the purpose of Guy's question?
He was looking for Gail, but she had already left the office. Belle thought they were both excited about the pregnancy. She didn't know Gail was keeping the pregnancy secret. Do you think we should revise our policies and procedures? Maybe Belle needs more training on the minimum necessary rule.
I'm sure Belle understands her error. HIPAA requires us to identify persons in the workforce who need access to records to carry out their duties. We're supposed to identify categories of PHI, but we can't impose any conditions on Belle's access to records because she needs access to everything. The first thing I'm going to do is call Gail and explain what happened.
HIPAA provides a framework for minimum necessary rules. A small office usually allows their staff to access everything. The inadvertent disclosure in this tutorial should be treated as a security incident. Thanks for joining me in this tutorial. Now I want you to meet my colleagues, Roman Diaz, President of Touchtone Compliance, and Karen Darnall of Darnall Law Office.
We made these tutorials to help you learn about HIPAA and California law. For individual attention, go to our contact page. You can send us a message or schedule a consultation.
And I'm Roman Diaz, President of Touchtone Compliance. Our online tools and expert services provide everything you need to successfully address HIPAA compliance. We identify vulnerabilities, provide a thorough risk analysis, and assist with mitigation plans, policies and procedures, and staff training.